Prosthodontic. First and foremost, I think I would say, how do you pronounce prosthodontics, right? I've heard people mispronounce it.
Yeah.
So even just, let's back up a little bit and say prosthodontics. Most people they have trouble pronouncing it. So let's just clarify that, right? It's pros. If you were to say orthodontist, this is really the same thing. It's prosthodontist, right? So that's just to clarify, right? In layman's terms. I would add to what Dr. Shah said. Can we do treatment better? Do I prep crowns better? Do I do treatment better than someone else? Not necessarily. I would say that our wheelhouse is in seeing the big picture and then being able to make a plan, and then sequence. I really think it's in sequencing the treatment, because you can start here and you need to get here, and you can do a quick short route, or you can go through a costly time mismanaged treatment that eventually maybe gets you there, but you could have gotten there better. I think prosthodontics, to me, how I see it is really treatment planning and then sequencing. That's where our I guess maybe one of our highly valuable skill sets is.
Right.
Versus,
in addition to that, I would say before the treatment planning is just being expert diagnosticians.
Yeah.
The way we sit down and talk to patients, we try to understand them as a whole. Again, not just jump into, what pockets you have or what cavities you have.
When you come and what we see is different than I think what most people see. When you come to us and we sit and look at you and we say, oh, I see how this puzzle already should be sequenced and put together to get you to where you need to be. I think that's kind of the real essence. And then our hands good to do? Yeah, of course. But that's, I think, where we shine.
Why do you think the Smileloc clinics chose the kind of doctors they did? From what I understand, they're specialists, so-called specialists that are involved in the treatment of patients. Who are the specialists?
Oh, I don't know if you guys have anything to say about that.
Well, I want you to answer that because I want to tie that into the question that was asked, like why is like our treatment at Smileloc centers is cheaper than the rest. I would love to tie that to it.
Before we get it, let me see if I. So, this roundtable is for patient benefit, patient consumption. I want to maybe, if I were to categorize some of the topics we've discussed, I would say there's so many patients that are in need of this treatment, and I was intrigued by your comment about the consensus of the European and American. That to me seems like such a basic question, but then when you look into it, no, it's not basic. And if we can't answer it, you have this whole pool of patients out there that are coming to us for that answer. If we don't have the answer, who does, right? So there's what I'm saying is there's such a lack of information and education for patients in this world, in this treatment, in this realm. And dentists need to provide that, or the dental profession need to provide that. And we actually, I think, need to do a better job of informing the patients, right? So coming to some sort of consensus on who fits in these categories, and then giving the education to the patients, I think, is where we start. So in my mind, there's a bucket of patients who just need to know, am I a candidate for this treatment, and who's this treatment for, and how can I get educated to find out if I should do it? Then if you've moved past that, there's a whole other bucket that to me really needs a lot of education. I'm hoping we flesh this out at some point, whether this roundtable or another. But when I start treatment, are all treatments the same? If I go to Dr. A and get full mouth implant treatment versus go to Dr. B or Smileloc Center, is there a difference? There's a whole, the waters are so muddied in just that. So again, pre-treatment information, during treatment information, that there's just, we need to clarify there. And then post-treatment, post-operative care. I just think there's so much missing. That's what we're hoping. I see as this roundtable trying to get some sort of consensus. So I think I'll stop there. I don't know if I probably didn't even answer your
why
question.
the specialists? Couldn't somebody's own dentist
Yeah.
do this? Should their own dentist do this? I mean, why go to a special clinic where this is being done every day? How did Smileloc decide to do it the way they did?
Yeah.
So first of all, the
Yeah.
specialists that we have at Smileloc centers is we have prosthodontists, we have surgeons, maxillofacial oral surgeons, and then we have anesthesiologists. So when we have the surgery going, like there are 3 specialists that are fully involved in that patient's treatment, just even for the surgery. And then in addition to that, we have the CAD/CAM specialists.
Yeah.
And like everybody who are involved in this type of treatment, they're at the best level of training, and they have the ability to provide and serve the best outcome to the patient. So we have these specialists. The ultimate goal is to serve the patient, right? We want to give the patient the best outcome and the best timely managed way, right? We don't want the patient to wait a long time. Everything has to be done in a sequence that is just right for the patient, right? It can't be too fast, right? Because the tissue has to heal. The implants has to integrate. Would you like to add on to that?
So I may add to that. I think I agree with everything you've said. I might rephrase it a little bit differently as well, just to kind of answer your question. I truly feel any qualified dentist can probably do the procedure, right? That's with the right amount of training, right amount of intent. Can a person do it? Yes. But when you go see a specialist who has dedicated their sort of career into just doing one thing and one thing well, you are getting somebody who is able to mitigate risks. So you reduce your amount of complications potentially, right? So that's kind of where I see the advantages. Like, my analogy, sometimes I give it to patients as well. It's like you're getting a car. Any car is going to get you from point A to point B. It's how do you want to get there? Do you want to go long-winded route, get lost along the way, or do you want to, go in a most efficient manner and get to that in a safe pace, not have your car break down halfway along your drive, and the same way with your mouth. So if you can mitigate many of those risks, and I believe that because the specialists have seen a lot more of these things that do go right, but also when they don't go right, why they didn't, they do a deeper dive into why things didn't go well. They do a deeper dive into what are the factors that will give you higher failure rates, complications, whatnot, and almost will tell you when, what would their right advice be. So I think that would be my take.
That was beautifully said. Let me just make one kind of, out-of-the-box comments. So here you guys have said you got the best specialists and the best team. It's all coordinated. And in the back of my mind, I'm going, okay, so this group is basically what they're saying is this is all gonna lead to why they're more expensive than anyone else, is because they're a super qualified group. And then it's making me feel like, well, I could never afford that. I would like to be with the top people, but it just sounds so far out of reach. And then I look at the pricing structure and what's offered in the product for Smileloc implant centers, and I see that it's modestly priced. There's something that just seems off about this. Do you follow what I'm saying? That here you have the highest quality doctors doing treatment and at a lower price. Usually when it's high quality, it's higher price, and now you're high quality and lower price. It doesn't make sense. I don't know which of you would like to answer that, because I'm just curious.
I think all of us could.
I want to say one thing, okay? So I come from a different perspective. My last 10 years, I've provided this treatment all over the country. So I only say that because I have seen that the same issues in California are the same issues in New York, are the same issues in Florida. This is a universal thing. So what I'm saying is, no matter where you go, these are issues. People, no matter where they get this treatment, I have seen the treatment can be provided in multiple different ways. You can do surgery in several different ways. You can fabricate teeth in multiple ways. What I find, no matter how, let me back up. All of those ways have pros and cons. What Smileloc centers have figured out is a very specific, streamlined way to do this, and cutting out a lot of the waste. And because we can get you from A to B in a more efficient way, and because we can do it with specialists, and also there's several reasons of why it's less expensive, but what I want to say is there are new technologies and new methodologies that are better than anything we've ever seen. And I've been around the block to see what's out there. I've been around the block to see all the methods and the ways, and we've been doing it very similarly the last 30 years. Not a lot has changed, but new technology has changed the game. And I think the technology we're talking about are things that we've actually ourselves innovated. And also, we all come from this market. We've all been in this market for over decades and decades, okay? And we now have come up with methodologies that can get people treatment, better outcomes than we've ever seen before, for much less. And what we're seeing is this conglomeration of this almost melting of experience and technologies into providing this treatment at a way lower cost. And what I've learned with patients is, once patients understand, not that they don't want this treatment, but when they find out that they can get this treatment for a lower cost, and the moment they realize that the quality is not going to be compromised, in fact, it's better, the light turns on. You see them go, oh, why would I do this anywhere else? That's my 2 cents.
I think that's well said. Tell me, what is the quality that's better? So if you have a Smileloc full arch of teeth, is it better? What's the quality feature about a Smileloc full arch of teeth?
So for me, the quality is how it fits, right? Everything. Like if the teeth fits right, and then at that point, the material is almost irrelevant, right? If commonly what we have in dentistry for full arch, we have printed teeth, we have milled PMMA teeth, or we have zirconia teeth, right? So the quality for me is to make sure that the fit is correct. Because if the fit is correct, when we use different materials, it's not going to matter too much.
Explain fit, just to kind of...
Right, I was just going to get to that, fit. So it has to, we have the implants. The implants are placed in the bone, right? And these are multiple implants. Like, we don't have only one implant. And we are going to place a bridge, right, on these implants. Like, minimum we need 4 implants, right? And then when we place these implants in the jawbone, they're going to act like 4 legs of a table. And it's very crucial how we place those implants, right? They have to be placed very strategically. Let's say we get that done in the surgery. Thanks God to our amazing surgeons, got the implants in there. Now, as a prosthodontist, our job is to make sure that we get the proper records of these implants in the jawbone so that we can put the teeth, the bridge, on these implants properly. And the only way to get it done is with the technologies that we have, the photogrammetry, and the proxy guide that we use, that we have innovated.
The VJIG.
The VJIG.
Yeah, it's another one, yeah.
And like, so what we do is we use the technology and then we verify. We want to make sure that before we put the teeth in, our impression is great, our impression is verified. We know the prostheses that we are going to put on the implants are going to fit perfectly. And once that is accomplished, then we know the teeth are going to come together right, they're going to function right, and then the teeth are in the right place and they're going to look great. So everything is like a domino effect. Once we get the implants in the right place, once we get the impression, once we verify the impression, and now when we put the teeth in, the patient will be able to eat well, function, speak, and then the outcome will be pretty.
I don't know who I could ask this to, but the name of the clinic is Smileloc, and I've got a model. This is an implant here that's coming out of the bone, and then there's this part here, and I wonder if we could ask one of the prosthodontists to explain to our listening audience what it is that I'm holding in my hand and why it is that our clinic is called a Smileloc Clinic. So one of you specialists
Dr. Shah.
maybe.
You want to start off or explain? I'll give you my 2 seconds, yeah.
So, very interestingly, what you alluded to is the key behind this whole thing is this locking device, right? This is a special material that is currently being used by NASA. It's space technology. So literally it's rocket science is what I'm holding here. It's space technology that's being used they have these space shuttles, how they
Connect.
release and connect and disconnect different parts and drop it. It's all done by this thing called a shape memory alloy. It's made out of nitinol, and there's some a lot more engineering behind it to set it in a way that this literally locks in whatever you put on top of this as the prosthetics, the crown, the teeth, to an abutment that is placed on that implant. So this thing basically locks in the two pieces together in various different ways.
So
and
instead of
keeps
gluing it together,
instead of gluing it, cementing it, or screwing something down, it's holding tight. This thing locks that in, hence the Smileloc, and locks it in.
is it tight? Is it tight?
It's solid. When it goes in, it clicks in. You'll hear a little bit of a click, and it gets in, and you won't be able to pull it out. The feature behind this is the shape memory alloy. At will, for various reasons, if you needed to remove it for hygiene purposes, for any other reasons, to check the tissues, to check the implants periodically over time, you can shine a little device to it, and in about 5 to 8 seconds, it unlocks and the whole prosthesis comes off.
Wow.
So this way,
So you don't have to unscrew it or uncement it or something like that.
Cementing, if you were to try to uncement a cemented restoration, oftentimes you're destroying it, you're cutting it off, you have to make a new prosthesis. And I always challenge my students that, okay, you cut it off, who's paying for a new prosthesis? Who's paying for a new crown?
So from what I understand,
what a headache.
no other implant clinic in the United States does this. Is that true?
Yeah, I'd like to add to what Dr. Shah said. So yes, the answer is yes. No, this technology, to give it just to kind of put it into where this fits in, this is new, but it's not new. It's been developed for about 15 years. It's been developed at UCLA. It's got credible research behind it, clinical trials, FDA approval. So it went through all of that process. But for the last 3, maybe 4 decades, to actually put a tooth onto an implant and connect it to where you can have it in your mouth and function and smile, that was always done either by cement, which would get everywhere, cause infections, cause bone loss, cause all kinds of problems, or it was held on by a screw. And the screw would loosen, it would break, there was a big hole that the screw had to go through. So food's getting trapped, bacteria, it smells, it weakens the tooth. So all these things, but until now, we've never had another option. It always had to be cemented. It always had to be screwed, one or the other, and just kind of almost pick your poison. So now, I don't know how many hundreds, if not thousands of cases have been done with Smileloc. It changes the game because now not only do you not have a hole in your tooth, not only do you not have to use cement and all the all the negatives with that, you have something that literally snaps on like Dr. Shah said, space age technology, and it's retrievable as well. So when it's in, it's locked, hence the name. It's locked into place. It acts and functions like a real tooth. You chew with it, you smile with it, you're not worried about it falling out. If you need, for whatever reason, to remove it, it's a simple process where you can have that shape memory alloy, go back, remove it, and then lock it back on after that. So I would just say this is a totally different connection system that has never been used before, which, yes, you can only get at Smileloc centers.
Wow. That's really great. I mean, it sounds so, NASA, high-tech. What do you say about it? I mean, having a technology like that?
I really don't have to say anything about you have to hear what our patients say about it. And these are patients who actually had like one arch screw retained, and then somewhere else at a different provider, and then found us and came to us, and then we did the other arch with Smileloc, and she was just like, that's it. Like it took us like, less than a minute to remove the healing abutments and seat it in place in 20 seconds. And she's like, that's it, no drilling, nothing. We are not doing any of that. I mean,
no screws, no torquing, no.
She's like, you didn't come to me with that torque wrench. We don't need to use that hand piece. We are not gonna drill. No, you just have the wand. I said yes.
What you said exactly. I was gonna tie it back to your other original question about the cost factor. The whole system is optimized by all the thinking specialists and behind the scenes. So from the time they take your records, the planning is done virtually on the computer. They know exactly where there's bone, where there's no bone. Guides are made efficiently. So the surgery happens a lot more efficiently. Prosthetics happen more efficiently. I've had cases, the prosthetics can go on for 3 or 4 hours trying to convert a denture, make a temporary crown.
So if it takes you less time, then it's less costly, right?
Well, exactly. So the cost savings are then now transferred to patients so that they benefit.
Is it fair to
from
say
this.
that this is one of those exceptional times when higher technology leads to time savings and less cost?
100%.
Yeah, I would say, 100%. The Smileloc technology is the main reason the costs can come down, right? We've had to make, so let's back up and look. People come into the clinic because they want a new smile. They're not looking at implants. They're not there to buy anything else. They're not there to buy the surgeon's credentials or the prosthetist credential, whatever people are selling in the market. What people actually want, the end product, is they want a smile. They want 3 things, actually. In my experience, they want these 3 things. Number 1, they want something that looks good. Number 2, they want something they can chew with. Okay, something they can function with. Really simple. Number 3, they want something that's going to last a long time. That's really it. So how does Smileloc help all of this? Well, Smileloc technology comes in and allows us to get those 3 things quicker and easier than any methodology we had ever before. So there's this process that we use built around Smileloc that gets that outcome every time in a quick, easy way. We've never been able to do that before. The way that we would make those smiles, if we needed to get something that looks good, something that functions well, something that lasts a long time, it was a whole, if the patients looked under the hood of a car and saw what happened behind the scenes, they would understand why it cost so much. It was a lot of work, it was a lot of expertise, it was a lot of time, it was this whole antiquated process to get there. Now we don't have to do that anymore.
How much time are we saving? I mean, is it,
Exactly.
you're saving 10 minutes, or, I mean, how much time are you saving compared to the old treatment method?
Well, I mean, if you look at a conventional full arch clinic, like let's say, just correct me if I'm wrong, but the surgery is like 3 hours, and then like they would spend like at least an
Another
hour and a
4,
half,
yeah.
2 hours for a double arch to do the prosthetics, right?
I would even say
More,
2 to
I would
4.
say more.
I'd
2
say-
to 4, right?
Yeah, 2
Well,
per arch, yeah.
I only spend 45 minutes, and that's it. We actually don't have additional conversion time. Like once the surgeon is done, when the surgeon is done suturing, the case is done.
So if I'm the patient, I kind of like that. I don't want to be in the chair for 6 or 7 hours.
No, you don't.
Yeah, you wake
So-
up from the surgery,
Mm-hmm.
you have another 4 hours to go,
Yes.
the numbing's wearing off.
Yes.
At the end of the day, they just want to go home, and you still have, and the question, I've been there, we've all been there.
Yes.
How much more time, doc? How much longer? And then you get the teeth, they don't
No,
look
they
good.
don't fit.
They
Oh
don't
my
fit.
gosh.
You spend all that
You
time.
name it. They
Yeah.
don't fit. They don't look right.
Yeah.
They don't come together, right? And then it's 5 o'clock,
No, it's not
4:30.
fun. I'll give you an example.
Oh, gosh.
This is a personal example of mine where, obviously in the teaching environment, resident's case, surgery got done, we did the conversion, and the resident did the conversion, everything, and the occlusion was off. And
The
I was-
occlusion, the bite,
the
yeah,
bite
the bite
was
of the teeth.
obvious,
Yeah.
not looking good. It was not fitting well. We
Yeah.
couldn't let the patient go like that. We had to keep adjusting. I was there till 8 o'clock,
Yeah.
supervising the residents, and it's a long day for everybody, and let alone
Yeah.
the patient's miserable. So it was like, why are we doing this?
So let me even add to what he just said, okay? So, because I've been there, we've all lived it.
Yeah.
It's so miserable for everybody. So now you've put all this effort into making this temp, and it doesn't work. So now you spend all this time adjusting. The patient goes home, but what they go home with is just
You can do a lot.
horrible,
Yeah.
right? It's poor quality. It's not going to last. It doesn't look good. It doesn't function well. So now what this puts you into a category, which is most people don't know this unless you've lived it. Now you're in a category where corrections have to be made,
Yes.
and corrections is the devil.
It's
Because it's very difficult to make those corrections and then do it in a way till you can get someone in a good smile again quickly. So the whole concept here for me, and the answer to all these problems is that first set of teeth have to turn out, right? Patients are going to judge whether what makes this successful or not is that patient getting their first set of teeth and they look in the mirror and they love it.
Immediate smile.
The immediate smile.
The immediate smile.
Yeah.
That is what we're looking for.
What people don't know is they advertise before and afters. What they don't tell you is that after could be
Yes.
9, 10, 12 months later.
How many trials?
How many try-ins? How many breaks? How many misfits? How many, oh yeah, we got you here.
Yes.
What we're saying is, no, you come to Smileloc, and because of these processes, your first smile is perfect 95% of the time, I would say. It's the outcome of that first smile is almost always accepted by the patient. If we have to make corrections, guess what? It's real simple. It's not hard. We make these little tweaks, and we're going into final restoration.
Dr. Ross, so you and I'm Ole Jensen. I'm an oral surgeon, and Dr. Ross is a prosthodontist. And we wrote a scientific paper recently, and it was published in the Maxillofacial Clinics of North America in the spring issue. And what was interesting about this paper, it was about full arch treatment, the current modern methods that we're talking about. And what was interesting about this paper, and I want to ask you about it, Dr. Ross, was that we determined a method to increase accuracy and predictability, and also patient satisfaction with treatment for complete arch. And what was also kind of interesting is there were 33 doctors around the United States, different doctors around the United States involved in this study. We had 111 arches. So it's a scientific paper, but just to kind of explain to our listeners in sort of layman's terms, what did we find and what did we conclude about these modern techniques in terms of accuracy and decreasing the time and making it more cost effective for patients and a better product for patients? Could you kind of just explain what our findings were?
Yeah, sure. So it was kind of surprising because as we worked on the paper, the idea was, the premise of that was that if someone goes through this treatment, you have a surgical section, surgical part, a surgical phase, and then you have a restorative or a phase where we make the teeth. And what people don't understand, laymen or patients, they don't understand that the surgery there's been a lot of advancements in the surgical phase of this. And there's a lot of great surgeons that can do that part. What they don't realize is that the tooth making or the restorative phase is not changed in 30 years, 40 years. It hasn't changed hardly at all. And that phase is still the biggest headache in the world. No matter where you go. So that restorative phase, the question is, why is that so difficult? And what is the source of those problems? That was the premise of the paper. Okay, why is that happening? Why is it difficult? And so what we found out was where things go south is that first smile.
Yes.
If that first smile, that's what was revealed in that paper was, if the first smile turns out well, the patient goes into this easy road to final. But if it did not turn out well, and the patient rejected the outcome, it went into this whole what we call the vicious cycle, where there were repairs and redos and corrections, and it's costly. And what ends up happening is, and this is what the majority of paths are take, where majority of treatment goes in this whole full arch treatment. Most, the vast majority go to patient rejecting to vicious cycle, and the vicious cycle drains resources. It creates stress, it creates frustration, and so at the end of it, you need more time. All of it ends up with the patient having a horrible experience, frustration, stress for everyone involved, and more than likely a poorer outcome. And so the question then becomes, well, what is required or what is needed to get a good smile the first time every time? What makes that smile great the first time? And when you dig into it, it's everything that we have in our processes. When you dig into what creates that smile every time, predictable the first time, well, it goes down to the fundamentals of prosthodontics. And there are laws that go into that. It's not hard, but you have to follow the rules.
So were you saying that you and your team developed and modernized a very old archaic approach to prosthodontics that hadn't been fixed for a long time, to coin a term, and use some new technology, which you might explain to us, and that same technology now you're using in your Smileloc clinics to make things so people aren't going to have trouble like that. So you kind of explain maybe some of these techniques.
Yeah, very well said. I explain it this way in layman's terms. If I were Chick-fil-A or McDonald's or anybody that manufactures a product, okay, if you go to Chick-fil-A, the end product is a chicken sandwich. And I know if I want that chicken sandwich to turn out every time, I know that I need chicken, I need buns, I need Chick-fil-A. I know I need the inputs and then go through a manufacturing process to produce that sandwich. Okay, if I were to use that as an example, we know that the old prosthodontic methodologies and kind of rules you have to follow, there are inputs for a smile. and you need to have those inputs put together in a way to get that outcome. And we developed, this is one of the reasons why we get the smile right every time, is we've developed a methodology that's used during surgery that gathers those and puts those together digitally to where we control those, where we get that smile. This is the first time it's ever happened that I know of. I think I know kind of what's out there, and I would say that what we've been doing at Smileloc centers is those outcomes are pretty much assured if we follow the rules, right? And so our methodologies not only get those outcomes, but we can do it for a lot less.
And you use a special camera or something like that too. Tell us about that.
So the inputs to get that smile, there are 8 records. One of those records is probably the most crucial, or one of the most crucial, but it's the enabling technology. It's called photogrammetry. And all photogrammetry is, it's again, technology been around photogrammetry itself's been around 40 plus years. Photogrammetry in dentistry has been around maybe 15 years. And it's just come to fruition and kind of become popularized in this field probably the last 2 to 5 years. Let's just say 2 to 5 years. But it's wonderful because it is the technology that opens the digital door to digital processes to make those teeth. Without it, we're stuck to analog doing
so
things by hand.
So you're taking a digital picture with the camera, and that's what you mean by digital.
Yeah.
As opposed to doing what? What's the old way of doing it?
Doing it by hand. So when you can make a set of teeth by hand, you can get the inputs and gather the records by hand, or you can do them digitally.
By hand, you mean taking a mold of the teeth?
Yeah, physical records. Whereas now we can take digital images, and then we can use software, and then we can produce teeth through software or CAD/CAM.
Wow.
It changes the game.
Wow.
But without the technology, it was just impossible.
So
but
no more gooey materials, right? No
Yeah.
more gagging, no more just filling all.
Waiting 5 minutes.
Exactly,
Yeah.
like
Or redos, or
No
having to redo it again. 'cause it
One
didn't turn
time
out.
I had to take a mold for a tooth I was getting, and it didn't turn out. So the doctor had to do it over again.
Do it again.
yes.
So you don't have to worry about
We
that
don't
anymore.
have to worry about that.
Or delete the portion you don't like and just rescan it.
So that saves some time.
So all these things, yeah, just exactly. All these things save time, and when you save time, you save costs, right?
Mhm.
You know, the more time, the
Well,
more effort.
How about accurate though? I mean, can a picture be as accurate as a mold of the tooth of the jaw?
Absolutely. The mold, from a scientific standpoint, the molds, the impression material, the shrinkage of your resins and polymers. You pour it up in a stone model, the stone expands a little bit. All these little expansion and contractions over time creates inaccuracies where implants are not forgiving. So if your prosthesis is not passively seated onto all your implants passively, you will get problems. You will get all the issues that we mentioned before with things breaking, loosening, coming off. So passive fit is something we really want to try and achieve. And these new technologies allow us to now capture that at a much more accurate. It's not taking one picture, it's taking multiple pictures at different angles, and it's been tried and tested where the accuracy is at a small micron level that is a lot superior to your analog.
And the thing that I would add to what he just said is those outcomes don't depend on necessarily the skill of the doctor. So the old ways, you have inherent expansion and contraction materials, and that's when you do it perfectly, let alone the human error that doesn't do it perfectly, right?
Yes.
A lot of this technology removes the variability that you find with different clinical skill levels, right? It just happens. It takes a lot of the variability out, so the outcomes are a lot more accurate. It takes the human element away in many ways.
All right, that sounds good. So at Smileloc centers, you're using this nitinol, what'd you call it? Some kind of memory?
Shape memory. Yeah,
Shape memory, so that the nitinol can change its shape according to just whatever you do, and it holds its shape in place unless you modify it with some energy or something. So that's really, really interesting. Does that allow you to make a different set prosthesis, the teeth shape and how big and bulky it is? Does it help you in some way if you use this instead of screws, for example?
Absolutely. I mean,
Well, how does it help?
Multiple ways. I mean, just starting even from the surgeries, it really allows us to place implants in the best available bone positions. You're not limited. When you had to screw retain something, you needed a straight line access. So if the bone was angled a certain way and you had to put an implant in a certain angle, then you have a big hole in the middle part of your tooth, and no one's going to accept that. Then we had to resort to angle abutments and change the angle and create some mechanical potential, uncertainties, because now you are loading it at a various angle.
But how about the way the teeth look and feel? Is there
So
are these teeth with the nitinol Smileloc, are they different somehow?
right, first of all, you don't have that hole now, so you are not limited by the angle of the implant. You can design the teeth where they belong for best aesthetic and function. And because of that, you can make the prosthesis a lot slimmer, a lot more comfortable. It's not as bulky to your tongue. And when it's
Is
not
it
that
easier
bulky,
to talk and
easier to, phonetics is better,
I
easier
see.
to talk, a much more comfortable feel.
Easy to clean.
Easy to clean.
Yeah.
The food is naturally shielded away from getting to surfaces that you don't have to bulk for reasons because your implants are not positioned properly. There are many advantages that this allows us to do as opposed to.
So is it feel more natural, right?
Yeah.
When you have to use a screw to connect teeth to an implant, well, that hole has to be hidden somewhere. So you have to strategize where you're going to hide that hole. Well, wherever the hole is, you need bulk around it for strength. And that bulk always adds to your tongue being closed off, your speech changing, pockets where food gets into, et cetera, et cetera. So when you eliminate that and you don't have to worry about wherever the screw hole is because there is no screw hole, then it changes everything. You idealize the size of that tooth based on what the material allows, and there you have it. That's your limitations. So it does change what we can do in terms of thickness, which translates to patient comfort.
Are dentists aware of this? Do dentists know this?
Oh, well, we are working really, really hard to spread this word to the dentists that we work with. I mean, we have a team that goes and meets, like we are calling the dentists in our area and letting them know, and then we have these meetings. We work with our oral surgeons. Do they know enough? Not yet, but we are doing everything in our power and trying to spread the word, because you're absolutely right. Because most of all these full arch cases, they are done with general dentists, and if the general dentist doesn't know that there's a better way, they are not going to do it.
But I might want to say, even though if it's available, there is some technique and process to knowing how to work with it and do it well. Like anything else in dentistry, people need to be trained, they need to be familiar with the process, because otherwise they could literally mess things up and not have the best outcome for patients. So even if it's available, I think it should be with somebody who's trained under the right methods, calibrated, know that the quality, that this doesn't account for sloppy dentistry.
Right.
It's actually a lot more precise than a cementing or restoration, because that will allow for more of it's a lot more forgiving. You can have a very loose crown and you just have a thicker layer of cement, and that will make up for that difference. Here, it's a little too precise, so you have to do quality high-end dentistry for that too.
What I want dentists to know, though, with the right training, what they realize is it's actually easier. This is this is new technology, but it doesn't make things difficult. It actually, when you realize what it does, you realize, oh, this is actually simpler. This actually takes way less time. Oh, this is actually more precise, fewer problems. And so that's the message I think we want to get out. Yes, of course, you're going to need some training to know how it works.
Mm-hmm.
But once you learn that, it's not difficult. It simplifies things more than complicates things.
Do you three doctors think that this is something that you could use in almost any implant that is placed? In other words, could it replace cement and screws as a method of holding in crowns and bridges and full arches?
Definitely.
I want to clarify one thing though, what I see. Full arch, yes. I believe every full arch case from here forward should be done with Smileloc. I don't think there's any question
So I
about
don't
that.
think there's any exception really. Well, that would be a tremendous advance. Why have the dentists been slow to, to jump on the bandwagon here?
Couple of things. I think the company that produces this product, right, Smileloc Centers, has been in the making for 15 years. So this has been a slow process, but it's been a process of integrity to do it right, to get FDA approval, to do the clinical trials, to get all the data, get all that done has been a lot of work, a lot of expense. Now what you're seeing, so in large part, it hasn't been around that long. 15 years is a long time, but it isn't. I think that now it's coming to market. I think dentists are going to find out about it from our early communications in the market. It's being adopted with success, and I think it's just a matter of time before it spreads. But in large part, I think it's just really messaging and effort to
And
get
then how
people
about
educated.
crowns? Like if you just had a single crown, should that have a Smileloc also?
So back to what I was saying, full arch, absolutely every full arch case I think should be done with Smileloc. I feel strongly about that. Single implants and whatnot, the wheelhouse is in the back teeth, right? It's really where it's used well. Can you use in the front teeth? Yes, but you have to know what you're doing.
So kind of more specialist for the front, but
Yeah.
still, you would say the majority of single implants, you can use the Smileloc.
I would say, again, every case. I don't want a screw. I don't want cement
Yeah.
in my restorations.
Right.
Getting rid of those two things has been a huge, in my opinion,
So this is what I would do. I would try to plan every case for Smileloc,
Yeah.
and then it comes back to planning, right? Because we want to have to always have the end product in mind, even before we extract the tooth, even before we place the implant. And I would try to do it every case with Smileloc, even the single implants. Now, will there be some cases that we may not be able to do? Absolutely. We always have challenging cases, right? We have to do things differently. But as long as we plan it from the beginning to use the Smileloc technology, I think we can do single implants, implant bridges. It's all about planning it and making the right records from the beginning.
Let's talk about planning because, I saw images with the implants associated with the x-rays of the patient, on the computer screen, and I realized, I asked myself, well, how did that implant picture end up on the jawbone structure on the computer? So is that part of the planning? Tell us about the planning.
Absolutely. So, the patient, first thing we have to acquire is a CBCT, right? It's a three-dimensional X-ray of the patient to make sure that we have
So
enough bone.
that's the CAT scan.
That is the
Yeah.
CAT scan. And then once it is determined that the patient is a candidate for an implant, let's talk about the single implant first, right? And then we have a tooth that is not restorable, needs extraction. So then we can actually do a intraoral scan. And we actually have the ability to merge these two files. So in our software,
On the computer.
on the computer.
Uh-huh.
And in our software, we can actually plan where we want the implant to be, But before that, we can actually plan the crown, the final crown
Wow.
on the
Wow.
software.
Wow.
And then we plan the implant. We can even see where the trajectory of that implant is going to be, so that we can actually plan for the Smileloc where we want it to go. We want to have adequate material on
So
the
if
crown.
somebody came in and they had this x-ray done, you could show them your plan for them ahead of time?
Absolutely.
Yeah, it's actually doing
Absolutely.
treatment on the computer before doing treatment on the patient. It's doing a
Yes.
virtual surgery,
Wow.
virtual treatment,
Absolutely.
and then just taking that to
And
the
that-
patient.
System that we have that we use in surgery.
Mhm.
If you can
All
a
of
little bit
this,
elaborate
so
on
all
that.
of that work, what I want you to understand, if the patient knew, like I said, if they opened the hood and understood what was being done, all of that work is strictly to go into surgery so we know what we're getting into. And again, the whole effort is to produce that first smile.
Immediate
that-
smile.
Immediate smile that the patient's going to accept. If we fail there, it doesn't matter what's done prior. One thing I want to add, okay, well said. One thing I want to add, I've been doing this all over the country, okay? The methodologies that was just described are not the common methodologies to prepare for surgery. So if you're a patient, whether you come out to us or wherever you go, you need to ask your surgeon and your team, your dentist, how do you do these things? It's important, because what you don't want, and I see this all too common, is you get to surgery and you're winging it. You're going in there, you're removing things, you're placing implants wherever you can, and I've seen this 100,000 times. The result is not predictable. The result could have been better, but so why don't people do it that way? Why don't they go through the methodologies? Well, number one, it's a lot of work. Number two, there are costs associated with it, and I get that. However, you're going to pay either up front or you're going to pay in a less than ideal outcome. So a lot of people freehand it. I don't want to say wing it. There's more to it than that, but they don't. There's more preparation that can be done that a lot of times is avoided because of costs and effort, and the shortcut into the surgery, and that first immediate smile ends up not panning out like it should, like it could. I want people to know there's a right way to do things. There's a not right way to do things, however you want to say that. Every case at the Smileloc Center goes through this methodology. Is guided surgery. It's the best way to place the implants. Photogrammetry, proxy, technology, planning. It all goes in to get that first immediate smile. There's no compromise in the process. And again, it's because of that outcome that patients want. We don't provide that, we've failed.
Let's talk about the financial side for a minute. I notice in your brochure and your ads, and just a sense of transparency. You actually say what the charges will be, and the charges are lower, and shockingly much lower than the average for this treatment. What's the reason that you can do this at such a low price, and how can you make it go? You know, if you're so much under the market in terms of cost. It reminds me of when Honda came out with cars, from Japan. They started selling these low-cost cars, and we were all shocked. We didn't want to buy them because we thought, there must be something wrong, but that ended up being a high-quality car that ended up taking over a lot of the American market. That happened in a lot of our lifetime, and we can kind of get that analogy. But now, here in a very transparent, open way, the Smileloc Center is advertising at a very low, affordable price for complete arch care. How can you guys do that? Somebody tell me about the financial part of it. Dr. Ross, you want to tell
Yeah,
us
so
how
first,
you make that happen for people?
Yeah. So first of all, I would answer that with what's kind of behind the motive. We know that this is a life-changing procedure for patients. We know that I know because I've done it thousands of times, when we deliver that smile and the patient looks at it, it takes off years of agony from not eating, not going out, fill in the blank. It removes, and now that chapter is almost over. Okay, so it's a life-changing procedure. We know that the costs have had to come down. That's something we've always wanted to do for years. We need to make this more accessible to more people, and you have to do that by lowering costs. So we have spent years and years and years on efficiency and production issues, and so we know that you can't compromise quality, and costs need to come down, and that only can happen through efficiency. So I would say, to answer your question with first thought, is that we knew it was needed, so we were motivated to do it, and we had to find a way. I would just say that the way that we do this now, I'm hoping costs even come down further. I mean, that would be great, because we know that there's tens of millions. It's estimated, anywhere 40 to 60 million people in the U.S. that could benefit from this treatment. Well, they can't afford the high costs, and so if something's not done, here you have this life-changing procedure. Wouldn't it be sad if it couldn't reach its potential in the market because we can't figure out a better way to do it?
How about you?
I'm going to add to that too, because I think what we've said is, the whole operation is very optimized in such a way that everything is under control environment where, again, you look at a Tesla, for example, they control everything. They don't buy a battery from somebody else and say, okay, now we're going to upsell you, and everybody takes their cut, and now that increases the price. Here, everything is kind of controlled internally, where all the savings that happens is now transferred to the patient, right? And we optimize everything, and now we're able to basically lower the cost. And that's one thing I think what Dr. Ross was saying. I appreciate what this is doing, is to be able to now reduce the cost to reach out to a greater audience and say, okay, here's an opportunity for you to afford something that perhaps in the past was not affordable. So that's one thing I've kind of always, admired and liked about, this company as a whole, where it's to disrupt an industry that has had sort of a monopoly, where to say, okay, we're going to do it with some level of integrity and honesty and openness, and have some heart in it, where it's more like, how can we reach and serve you better? So I mean, I'm going to rephrase something I've heard it from my mentors over the years, and I kind of live by and repeat it a lot, is we talk about a lot of scientific technology and high-end stuff, but in all honesty, like, patients don't really care how much you know until they know how much you care. Right? So it's us taking care of patients first. So whatever we do, at the front foremost, the patients to come first. And once we know, they understand that we care about them, everything else is easy.
Yeah, very nice.
And I want to add it to this a little bit differently. Yes, we have the ability to control everything. That's why we optimize everything we do. That's why we have a more lower cost. And I really like the way you said the modest price. And with that said, in dentistry, this is a pretty much general rule. I've heard this like when I was in dental school, and unfortunately, what they say is like, when you actually do a treatment, you have to price it in a way that if it fails, that you will be able to actually make up for that. So that's why I think it's being really on higher numbers other places. And we don't need to do that. I think that separates us from everyone else, because our goal is to do this the right way the first time. And we take our time to get the right records, whatever the lab needs, whatever the surgeon needs, whatever the prosthodontist needs, to get that best outcome in the best timeline in the first time, so that we can get to that immediate smile the first time.
I would add one more thing. This is a key point, I think. I just thought when you said that, I would say that I want people to know that this price point, the other thing that's unique and disruptive about this price point is there's one price. That doesn't mean the price changes if you need grafting, if you need more
Yes.
implants, if you need anything else, right? The only time it changes is if you need zygomas. That's another discussion. But this is what's very unique about this is a one price for actually anything you need. That's totally different than anything in the market, which is piecemeal pricing. We start here, and you'll see this in the advertising.
Yeah.
Starting at this. But what they don't tell you is, oh, but if you need this and this and this and this, and the next thing you know, it's up. So,
That's right.
so not only is it low, it's modest. I don't want to say low. It's modest.
Mhm.
I would even say fair. Okay.
I like
Yeah.
that.
Or pricing that makes sense. We've heard.
Yeah.
It's one price, anything you need, highest quality, and
And great doctors.
great doctors.
Yeah,
Yeah,
care.
I want people to understand that this is not a compromise in quality in any way. Actually, it's the opposite.
It's
But
just the opposite.
it's just the opposite.
We understand this is an investment for our patients, but we are invested in their treatment as much as they are, and we are going to do whatever it takes. Additional implant, yes. Bone graft, yes. Membrane, yes. Whatever they need, we are going to do whatever it takes in that surgery. We always go fully prepared, and to make sure that we are going to get the best outcome.
This opens the door for people that traditionally couldn't get this,
Yes.
because not only the financing favors also people with a lower price point. You open the market, you expand the market, because you can now offer this to more people. So my advice is come in and see.
In other words, because the price is lower, you can almost always get full financing.
Most people can qualify for financing.
Yeah, in other words,
Yeah.
before, when the price was higher, you could maybe get 3/4 financing.
And not only that, people were compromising maybe life savings, their home,
Yeah.
they wanted this so much. I've seen in the past where people were putting high risk
Mhm.
just to get the financing, to get the smile. It
And the
meant that much to
financing
them.
is over a long period of time, let's say 7 years or so, and maybe it's a few hundred a month or something like that, not 600 or 700 a month or
Yeah,
something.
changes everything, yeah.
I've enjoyed this roundtable conversation with you, very prominent doctors, appreciate it. Let's complete this or finish this conversation by talking a little bit about the human element. Maybe why you're doing this, and also what you observe in people, what their motivation is when they make this big decision, and how they feel about the treatment that they've had. So could we talk a little bit about the human side, because you've all had experience now, and maybe Dr. Kumar, I could ask you first, what comment would you have about the human side of making the decision and going forward with complete arch treatment with dental implants?
I think apart from our personal lives and all that, this is one of the major decisions that many patients would have to make. Most healthy patients, if they have full dentition, this may not be something they might need, but people that we've discussed who are on some sort of a terminal type dentition, they have delayed this process for various reasons, and now that they have taken the first step, they're looking to somebody to guide them the right way. Like, they're nervous, they're apprehensive, they're uncertain, they don't know if they're doing the right thing, and they're looking not just from an objective standpoint, these are your options and you can do A or B or C, but they're looking for some sort of guidance as someone who knows a little bit more, who's seen it, to give them some advice, right? To say this is something. So again, we always treat somebody the golden and the platinum rule about how you want to treat, or how you want to be treated yourself is how you treat them, right? And versus also, I guess the flip side is, I like the idea of the platinum rule, where it's again, you treat the patient how they want to be treated. They come from different walks of life. They come from various different backgrounds and limitations and hardships and means and finances, all that stuff. And once you understand that, I think understanding the patient who's sitting on the chair, once you understand where they're coming from, what their desires are, some people, might favor aesthetics over function. Some patients are the other way around. They just want functional, prosthesis that is somewhat decent aesthetics. You never know. Again, once you understand them from a personal level, then you can actually serve them the best way possible. So I think understanding who's sitting on our chair is critical. Again.
Some patients have gum disease, which can carry an odor that never goes away.
True.
They want to fix it, maybe they can't get it, so it fixes. They may delay treatment because of finances or whatever. What a tremendous burden that is for them professionally, even in their family. Are there a lot of people like that? I mean, am I describing something that's just a rare thing, or are there a lot of people that have that problem?
Unfortunately, I mean, you would think we're in America, and this is we don't see that. Unfortunately, I mean, even just access to care though, we have data that shows half the population don't even have access to good dental care. Mm-hmm. Half of the U.S. population. That's mind-boggling. So when they don't have that kind of access, you can just imagine how many millions of people are walking around with health issues, systemic health, oral health issues that just affects every aspect of their lives. So I think that is a challenging number that we have to kind of overcome.
Yeah, thank you.
The human element. So there's a story that I read when I first started my career in dentistry, and it opened my eyes. And I think the best way to answer that question is, there was back in the day when I was younger, there was a show called Extreme Makeover. You may or may not have heard of it. And it was basically a show where they would bring somebody in, they would do all the plastic surgery and all the stuff, and then show the results after. That was the name of the whole purpose. What I didn't know is I read this dental article one time where the first person the candidates saw was the dentist. And I thought that was interesting. And so I read on, and it said the reason that they want to see the dentist first was because if they couldn't fix the smile, nothing else mattered. And I thought that was so interesting, because you could have the hair and the eyelashes and everything else, but if you didn't have the smile, it didn't matter. And that was the first time I realized how important dentistry is. What we're doing is how it mattered so much to people. I do this for one reason. It's really simple. I've seen this enough. I've got enough experience. I've seen the lives it changes. I almost feel like it's my mission to figure out the best way to do it. And so all I care about is that end result for people, because I see what it does. And so my commitment to the profession is getting that result every time. That's really simple, because I've seen the joy and the change that happens. It's addicting. It never gets old.
Do you see patients that are ashamed of their smile? I mean, is that a rare thing, or is it pretty common?
Every day.
Every day.
East to west coast, north to south. There's so many people, and my invitation to people is just come and see, because a lot of people come in, they're bashful, they're scared, they're fill in the blanket, they're nervous, and that yet you go through this. I think the biggest reason people may not do this is the unknowns. They just don't know. They don't know what to, and then they go through it and they say, it wasn't that bad. Oh, this was actually pretty easy. And so it's just kind of closing that gap of the unknown to just getting good information out there, and then just getting people into good treatments where they can get the result. That's what we're trying to do.
Dr. Bay?
So, I love what you said, Dr. Ross, like that smile. And that is right on to the point, because when you don't smile, people think that you're angry. People think that you're upset with them, but that's not the case. Like, they don't smile because they don't want to show. And when you smile, it's almost like a reflection of how you feel, right? It's just like when you smile, like, oh my God, you're happy. And people want to be around people who are smiling. And people don't smile because they may have that issue, right, with the teeth. I don't know, it may be periodontal disease, that may be the odor, or the decay, or the teeth may be crowded, they are not smiling, and they are not gonna, because of the reason they are not coming to the dentist, then they're ashamed, or they can be anxious, they can be nervous, scared. And when they come here, we are very, very aware of that. And I don't want the people to think that I'm gonna get this smile and I'm done. What I tell my patients is like, once we deliver that final prosthesis to you, that's actually the beginning of the rest of your life. Our relationship together, because they're gonna see you every 6 months, and it's almost like you become part of our family, right? So they either become part of our family or they become our friend. So I want to make sure that they get the best treatment, as the best outcome, but at the same time, like, they understand how much we care. And I love it when they come back and first thing they give us a hug. I'm like, that's it, that's priceless. I think that's the best part of it all.
Absolutely. Let me just make a final comment. And I am very experienced in this in my career. And let's say I notice 2 tracks of people, generally pretty unhappy people. It's coming down this track. And on this side, this other track, pretty joyous people, pretty happy, outgoing, loving, confident people, men and women. And the track that's coming in that are unhappy are the ones that have suffered a lot. Maybe they have missing teeth, or they have painful teeth, or they have infected teeth, or they've delayed treatment, they're afraid of dentists or whatever. We put everybody to sleep, with an anesthesiologist. Don't be afraid from that standpoint. But anyway, I see this line of people coming in, the sufferers, and then the ones who have had treatment, gone through it, and they're happy. They're more content with their life, more accepting, they have more self-esteem. They are articulate. I had patients sometimes who I didn't think they talked. And
Yeah.
they actually chose not to talk. And then all of a sudden, I can't get them to stop talking. So there's something hidden inside of you sometimes, and we want to unlock that with our Smileloc technology. And I appreciate taking just a few minutes talking about the human element. It's one of the most rewarding things for us as treatment doctors, to help people. It's a loving thing that we can do. We're just excited to be part of a team that can offer these things to you. We hope to give the Smileloc Dental Implant Centers a shot and see what we have to offer. And thank you very much. Thank you, each of you, for your
Thank you.
contribution.
This was fun.
I hope we do this again. Yeah.
Yes.
Episode 2 coming up.
I know,
Yes.
I guess my 5-year-old.
Yeah.
Some pretty good comments, man.
Yeah.